Hi everyone, this is Joe and welcome to video number 2 for module number 1 for Introduction to Pathology. In this video lesson we're going to talk about the body's reactions to different pathological conditions, and those include inflammation, edema, ischemia and infarction, hemorrhage, and alterations of cell growth leading to neoplasms. The first one we're going to talk about is inflammation. Inflammation is the initial response of the body tissues whenever there's some type of local injury. And an injury can include, of course, a blunt or penetrating trauma, but it might also include infectious organisms or any type of irritating chemical substance on or within the body. When there's an injury and the inflammation process starts, you get 4 different events that happen. The first one is there's a dilation of the vasculature in that area. And this leads to an increase of blood flow to that injured site. And this is why you have swelling, and it's often warm to the touch. That increase in blood flow also helps bring more white blood cells to that area. These white blood cells are also called leukocytes, and leukocytes then enter the injured tissue. Once they're in the damaged tissue, what they'll do is they'll start to eat. They'll start to eat the cellular debris that's there. They'll start to eat up any type of infecting organisms that are there. And this process is called phagocytosis. Once the area is cleaned up by those white blood cells, then regeneration of the tissue will start. And if there's any type of trauma opening up the skin, then granulation tissue will start to make a scar. And then it will take time for that area to repair and heal itself. And it should be noted that some tissues, such as the heart, are unable to do this process of regenerate their old normal cellular tissue. You should be aware of the 5 clinical signs of acute inflammation, and they are 1, rubor, or the redness. Again, we're getting that high volume of blood sent to that area, which gives it that tinged red look. Calor, or heat, and again the amount of blood going to that area will cause heat. Tumor, or swelling, dolor, or pain, and then a loss of function of that bodily area while it's healing. And depending on the injury and the potential for infection, there may be some systemic issues, such as a fever developing after a trauma, which is fairly common, especially if there were organisms that had entered the body through a cut or injury. So this is quite common and sometimes related to the acute inflammation process. I wanted to quickly mention a pyogenic infection, which happens during the inflammation process. And so we know that when there's an injury, looking back on the last few pages, that you have this influx of blood. The blood brings some white blood cells. Those white blood cells are eating up dead tissue, as well as any type of microorganism that could cause infection. Well, if there is certain bacteria, you're going to have a mass showing of these leukocytes, or white blood cells, eating up all of these microorganisms. And sometimes when that happens, that pus will develop, and pus, as we know, is this kind of whitish, yellowish fluid, thick fluid that develops maybe in certain deep cuts or sores that have not been taken care of or not cleaned out, and that's usually a pretty good sign of infection. So I just wanted to mention that, and that if this does happen under the skin or within the body, you can have an abscess, and they're pretty disgusting if you do see them on patients. But an abscess is if you can palpate or see it, it's a large lump on the skin, but they can form within the body. But if you had broken that skin or cut it open, and sometimes it is purposely cut open to drain that abscess, pus does come out, and sometimes it needs to be drained in order for it to be cleaned and rid of the body. So I just wanted to mention that because I have seen infections in the emergency room that did have pus involved and an abscess involved, and so something that you might see if you're in the emergency room. All right, let's move on to edema. Edema is another way that the body deals with pathology and infection. It is the accumulation of abnormal amounts of fluid in extracellular tissue spaces or body cavities. And this is usually a result of the inflammatory process. I would think by now at clinical you've probably dealt with 1 or 2 patients with edema, probably inpatients, maybe an outpatient, but I'm sure you've seen the patients with very swollen lower legs, feet, ankles. And so when you see that, when you see a pronounced swelling of the subcutaneous tissue in a certain area, and again it's usually the lower extremities, that's something that we call anasarca. And there's also something called pitting edema, where if you had taken that patient, if you pushed on the skin, let's say at their ankle, and you pulled your finger away, the imprint of your finger would be left there. That's called pitting edema. And lastly, one more word I want to mention is elephantiasis, which is a localized edema resulting from a localized lymphatic obstruction, and that's elephantiasis. Edema most commonly occurs in patients with congestive heart failure, cirrhosis of the liver, and certain forms of renal disease. Now, I had previously mentioned that patients often experience edema in the lower legs, lower extremities, and that's some reason for that is the Earth's gravity. So patients who are able to walk generally accumulate this extra fluid around their ankles and lower legs. Any patients in a hospital bed or are non-ambulatory usually accumulate the fluid in their lower back, their lungs, and the sacral area. And this is why we do chest x-rays on patients who are non-ambulatory or have been in bed for a few days, as we want to make sure that they're not accumulating any fluid in their lungs. And that's often a question that the patient asks, well, why am I getting this chest x-ray? I haven't been coughing and I'm not short of breath. Well, we want to make sure that there's no fluid backing up and ending up within the lung field. And that's all for edema. So let's move on to ischemia and infarction. Ischemia is the interference of the blood supply to an organ or part of an organ, depriving that organ's cells and tissue new oxygen and nutrients. This is usually caused by some type of narrowing of the arterial structure, whether it be thrombotic or embolic. Now, ischemia can lead to infarction, and an infarct is a localized area of ischemic necrosis within a tissue or organ produced by occlusion of either its arterial supply or its venous drainage. The two most common clinical forms of infarction are myocardial infarction and pulmonary infarction. All right, let me stop right there because I've mentioned thrombotic and embolic occlusion more than once now. So, a thrombotic occlusion is from a blood clot within the vein. Embolic occlusion could be just about anything floating through the bloodstream that ends up in a vessel too small to handle that floating debris. And when I say debris, it can be just that. It could be anything. It could be a clot, but it could be fat, a piece of fat. It could be a piece of a tumor. It could be air itself. It could be the end of a catheter that's floating around in the vein. So that's what I mean by thrombotic or embolic occlusion. So let's see. Infarcts tend to occur in elderly individuals with advanced arteriosclerosis or impaired cardiac function. A really good example and memorable example of ischemia and infarction is gangrene. And I'm sure some of you have done some diabetic patients with foot issues or foot problems, maybe more specifically wounds on their feet that just won't heal. And so what they're dealing with ischemia and infarction, which ends up as maybe being gangrenous. And like I said, it can be a very memorable experience because it is rather disgusting. If part of the foot is looking black, obviously there's no blood flow to that supply, and that tissue has become necrotic and dead. And so that is usually what you see with gangrene, blackening of the part of the foot that is going through that ischemia and infarction. So anyway, that's all I'm going to mention with regards to ischemia and infarction. Let's move on to hemorrhage. A hemorrhage is a rupture of a blood vessel, and these can either be external, where the blood is trapped within body tissue, which can result in a hematoma, or ecchymosis, which is a bruise. So those words you should know for your test. Just a real quick reminder in some of the medical terminology that you might have forgotten from last September, but don't forget that the prefix hemo means blood, and then when you follow that up with where the blood is, that's where you can get things like hemothorax, hemopericardium, hemoperitoneum, things like that. So just a reminder of what that prefix hemo means. Now the word hemorrhage can be pretty scary, and I just want to wrap up talking about hemorrhage because I think you know what it is. It's a generalized loss of blood because of the rupture of a vessel. But you can lose up to 20% of your blood volume without having much clinical significance to it. However, where the hemorrhage occurs is important. So if there's a hemorrhage within your head, within your brain, that's going to be a problem. If it's your aorta that decides to rupture, then that is going to be a major problem. So where the hemorrhage occurs is certainly of concern, but you certainly can lose quite a bit of blood, up to 1/5 of your body's blood, without much clinical significance. So interestingly enough. And that's all I'm going to say about hemorrhage. We're going to move on to alterations of cell growth. All right, alterations of cell growth. Now, sometimes there are changes to the number and size of cells depending on physiologic stimuli. So that could account for the reasons for the changes in cell growth. So with regards to alterations of cell growth, I want you to know a few words. The first one is atrophy. And atrophy is when there's a reduction in the size or the number of cells in an organ or tissue. And usually this corresponds to a decrease in that organ or cell's function. So that's atrophy. Hypertrophy refers to an increase in the size of the cells of the tissue or organ, which is in response to a demand for increased function of that body part or organ. Hypoplasia, which is similar, but that just simply refers to the number of cells in an organ or tissue. So it doesn't necessarily affect the function, just the increase in number of those cells within the tissue or organ. And then there's dysplasia. And dysplasia really is some type of disordered growth or faulty development of that kind of tissue or body part. So they're not growing as they're supposed to or as they have in the past. For one reason or another, their growth habits have changed and they're no longer differentiated as that type of cell. So those are the 4 words that you should know with regards to alterations of cell growth. Now those alterations in cell growth can lead to neoplasia. And a neoplasm is new growth or an abnormal proliferation of cells that's no longer controlled by the factors that govern the growth of normal cells. These cells grow under their own rules and regulations, not governed by the body, and so they often form tumors and can spread and have no problem spreading throughout the body, and it leads to cancer. Neoplasms are often referred to as tumors, and the study of these tumors or neoplasms is oncology. So now within someone's body you have normal, healthy cells growing to form whatever kind of tissue it might be, kidney tissue, liver tissue, connective tissue. But now you've got these tumor cells, these cells that are growing with their own set of rules, and they're going to compete with the normal cells for the blood supply, for nourishment, for oxygen. And as the tumor cells grow, a patient will become more and more weak. And this condition, this weakness from these neoplasms within the body, is called cachexia. Neoplasms are either benign or malignant. They're either fairly, non-harmful, or they're harmful and with the potential of spreading to other parts of the body. Benign tumors grow with cells that look like or are close or similar to cells of their origin with regards to structure and function. They usually stay within a certain area, a certain space, without spreading to other sites, and but they're just a little bit different. And there are examples of benign tumors in the skeletal system coming up to give you good examples of these. But these can be removed surgically, and usually the patient has a high survival rate. Malignant tumors, however, they are aggressive, they invade, they destroy, and they spread to other sites, competing for that nourishment of your blood. And when they spread to different sites of the body, it's called metastasis. These malignant neoplasms are very competitive, and they're going to fight and destroy other cells in their way and around them so that they can receive more of that blood supply. Malignancies tend to be poorly differentiated and may be impossible to determine the organ from which they originated. So what that means is you usually have tumor growth in one particular area of the body, and then it spreads out. But it's not like you could find one of those cells and determine, okay, this came from the lung, this came from the bone, this came from the liver. You don't know where it came from because it just looks different than every other cell in that body at that point. Malignant tumors are referred to as cancer. Alright, so all tumors, whether it's benign or malignant, they have two basic things. The first thing they have is they have a group of cells that are distinguished for what they are as tumor cells, as neoplastic cells. So that's their parenchyma. Just like your lung has a parenchyma, the tumor has its own parenchyma, the cells that make it up. And then they also have supporting stroma. And these are supportive tissues that give it that nourishment. It's connective tissue, so it has some structure. It also leads to blood vessels, and also may have lymphatic vessels as well. Now, with regards to naming a tumor, you're just pretty much taking the kind of tissue it is and then putting OMA at the end of it, O-M-A. So any type of malignancy or tumor found in fibrous tissue would be called fibroma. Something out of fatty tissue would be called lipoma. Anything with regards to the epithelial tissues, skin, mucous membranes, are called carcinomas. And anything coming out of things like bone and muscle and cartilage are called sarcomas. And those are highly malignant tumors. We're going to learn more about them in module number 3. Alright guys, hang in there, just a couple more slides and we'll finish up here. So how do malignant cells spread throughout the body? There's 3 different ways. The first way is seeding within body cavities, and that's when a tumor cell releases cells that implant themselves at distant sites throughout the body. The second way is lymphatic spread. They use the lymphatic system to put cells into the lymphatic system, and it spreads to different parts of the body that way. That's often the case with regards to breast cancer and lung cancer. And then the third way is hematogenous spread, in which case tumor cells use the blood vasculature to travel to different areas of the body where they stop in the vasculature, penetrate the wall of the vessel, and then infiltrate that organ or site. So those are the 3 ways that it spreads. Alright, finally I want to talk about grading and staging. These are 2 things that oncologists use to help understand how progressive or how far along a neoplasm or tumor may be. So the first thing they might look at is the grading of a malignant tumor, which looks at its aggressiveness and to the degree of malignancy. How far has it spread? By understanding what grade of tumor that they're dealing with, that may help them decide which therapeutic agents will be helpful or most helpful for that patient. And the second thing is staging. And what staging really is determining how much spread there's been with that tumor. And when you understand how much spread there has been, you're better able to determine which therapy is going to be best used for that patient. And so that's going to finish up this video lesson. I hope you found it helpful. I'm sorry it was so long. If you have any questions, please feel free to email me, and I'll be seeing you at the next lesson.